Hello, it's Jennifer Johannesen and Emily Nicholas Angl from Matters of Engagement. Coming soon, we're bringing you a multi-part story that could change how you think about healthcare in Canada.
I think we are all right now very aware that we are in the midst of a primary care crisis. So I think everyone's thinking about how do we do things differently.
Yep, we all know our system is drowning. Emergency rooms are full, wait lists are long, and many patients don't receive the comprehensive primary care they need.
Effective preventative measures like screening, behavior change, and lifestyle counseling, they're often taking a back seat, which can have serious ramifications.
There's this famous story about a group of rescuers beside a river. It's one person after another they're dragging out of the river who's near drowning. And they're working their butts off. And all of a sudden, one of the rescuers stops and starts walking upstream. And the other rescuers said, "Where are you going? We have all these people coming to save." And he said, "I can't keep doing this. I got to figure out where they're coming from and solve the problem upstream."
This is the story of Better Women, a paradigm-shifting research project that's training everyday people to become peer health coaches, supporting others in making important health-related behavior changes upstream.
The Better Women pilot program pairs women with peer health coaches after an initial prevention visit with a prevention practitioner. Peer health coaches are trained volunteers who support women over a 6-month period to achieve and maintain their health goals. The primary objective is to assess whether adding the 6-month peer health coaching intervention leads to a greater achievement of evidence-based targets for chronic disease prevention, such as decreased smoking, increased activity, as well as cancer screening.
Most people don't realize that if you think about the factors that can lead to prevention of diabetes, well, those are exactly the same factors that will lead to prevention of heart disease, of many of the cancers, of prevention of arthritis, those what we call upstream factors.
In collaboration with the Canadian Cancer Society and Women's College Hospital, we're bringing you a 5-part series exploring prevention, peer support, and the power of community.
In this series, you'll meet the scientists who are dedicated to understanding and improving primary care.
We started to ask the question, what happens 6 or 12 months later? Do those changes that happen for the patient get sustained?
And you'll hear from the prevention practitioners working on the front lines.
Well, I wish everybody could have somebody like that. That's what you hope for. And I know many people that we see in a day don't.
And the peer health coaches, whose lived experiences are transforming lives.
What were you most proud of this week? What made you happy this week? And then they'd be like, you know what? I actually took a walk on my lunch break and I felt really good about that.
Someone rooting for you, someone being your cheerleader, having a partnership with you, not judging you, being compassionate in where you are, and helping you feel better is awesome.
In later episodes, we'll be bringing you the early findings of this research project.
And in our final episode, we'll explore what this research could mean for the future of healthcare in Canada.
We know that just telling people these things often doesn't work. And we know that people's environments, whether they be social environments, physical environments, work environments, occupational environments, all of those have a profound impact on health outcomes.
The ripple effect of this kind of program is interesting because those that have heard about it, we're hearing that, oh, well, my mother would love to be a volunteer as well. Or could my sister or mother who lives in that particular community, could she get matched with a volunteer peer health coach?
Join us for the Better Women series, 5 episodes exploring how peer support and community connection could be the key to preventing chronic disease and building a healthier future for all Canadians.
One of my participants actually told me at the end of 6 months, she told me, "Saba, you are my angel." And I never think of myself this way. I never thought that I would impact her life so much.
The Better Women series, coming soon to Matters of Engagement.
This series is brought to you by Matters of Engagement in collaboration with the Canadian Cancer Society and the Better Women research team at Women's College Hospital. Be sure to subscribe to Matters of Engagement wherever you get your podcasts.
The end of the Canadian Cancer Society's CIBC Run for the Cure is just the beginning, because the funds raised through the run continue to fuel life-saving breast cancer research, enable clinical trials that improve outcomes and bring you hope, and help patients every step of the way with vital support services. Join us October 5th and make an impact that lasts far beyond. Sign up at cibcrunforthecure.com.